So what have you had done leg wise? Have you done any varicose veins or spider vein treatments? Tell us about that experience.
Years ago, I have vein disease in my family, and as Dr. Pittman has said, it's caused by heredity and childbirth. Well, I've had 4 children, and I have vein disease on my mother's side and my father's side. So my ankles were getting all spidery, and that used to drive me crazy because you're wearing pretty shoes and you have these spiders on your ankles. So I just wanted that to clear up. So we did that. But then over the years, over 15 years, the last time he did my spiders, we saw that it wasn't clearing up. So we did the ultrasound, and I had reflux for a number of years. We were just trying to put it off. Anyway, I had the procedure, and I was a little nervous. So I went in, he did my procedure, he puts it in. It's not painful. Anybody who's had Botox or any kind of injections or any other facial peels, this procedure is really not painful.
So Botox is worse than the leg treatments that you have done, because doesn't Botox, when you inject it, it stings or something, right? I mean, what's that? I mean,
I'm such a sissy. I get numbing cream.
Yeah, see, I don't know anything about
When I get my Botox, I get numbing cream. There's a lot of women that can put up with that. So I'm real sensitive to injections, but it didn't bother me. And of course, with the procedure, the EVLT, he numbs you, and I don't know what he does, but I didn't feel it. He puts the numbing stuff in your veins, and then
they go away. So
and then he does. Yeah, he closes it down. They shut down. No pain. I put the compression stockings on.
Geez, we're going to end up going into a promo about our Botox guy, because I couldn't tell you had Botox at all. 4 kids? No. Come on.
So anyway, you put your compression stockings.
Compression stockings
on, and then he treats you with the foam. He closed me down with the foam. I just had my ultrasound yesterday, and I'm all closed down, and we're ready to start the next leg.
So you're his number one supporter, obviously, and number one patient as well.
Actually, I don't know that. Well, most of our patients are really, really happy, and they'd give me a run for my money. They really, really like him.
I mean, his business is blown up across the country. I mean, he's had some videos go viral. He's been in magazine articles. He's going to be featured on that program down in Boca, Becky with Boca, which is a big medical program down there that he's going to be featured on. He's doing a live procedure on some billionaire's hands or something. So no pressure.
A philanthropist.
A philanthropist, is that what it is?
Yes,
I could sense he was a little nervous about that. But I'm sure he'll do a great job.
Yeah, it's going to be great.
Yeah, and so that's going to be coming up here very soon.
He'll be driving that Corvette soon.
October 27th, we'll be down in Boca.
So, but how have you gotten to grow this business across the country? Has it just been referral based? Has it been marketing? Is it just, how are you getting that word out there?
Video and word of mouth.
Video and word of mouth doing it for you?
The internet. We get about 30% of our
The results have a lot to do with it too. I want to stress that.
And we've just gone up. When we first started, word of mouth was not as high. Now, a third of our business is by word of mouth.
Right.
So
and
that's great.
And I, before I met Dr. Pittman, to me, varicose veins was a surgical procedure that you went in and yanked out. So education and, has a lot to do with this too. Once people learn about this, there's a demand for this, correct?
I'm going into doctors' offices and explaining to them the symptoms of vein disease, because even them, they don't know the symptoms of vein disease.
Right.
And realize, put 2 and 2 together, restless legs, we can treat restless legs and get rid of restless legs by treating the venous insufficiency, and then the patients don't have vein disease or pain anymore,
right? Or
foot swelling, different things like that, or wound care.
Yeah, and the doctor has said many times, and it's you may be surprised at the conditions going on in your legs that are related to undiagnosed vein disorders. And he's educated to me many times on the program, and again, hearing firsthand today from one of his patients as well as his wife, Karen Pittman. So, got to wrap up the segment, but Karen Pittman, Vice President of Business Development with Vein 911. Thank you so much for being in the studio.
Thank you, Jamie. Thank you, Josh.
And you can reach out to them at 855-VEIN-911. They do offer a free consultation, so go in there and ask him some questions. Mention that you heard it on the radio show too. He'll like that. And also learn more at vein911.com.